In the mammogram, the patient stands here and the breast is placed here. This comes down and it squeezes the breast to make it as thin as possible. That's why many women don't like mammograms, because particularly that tender breast is quite painful. It's called the ouch effect. They're supposed to squeeze it until the woman complains almost. Because the thinner you get the breast, the better you get the penetration of x-rays and the more accurate it's likely to be. So it's done in this plane, which is called a craniocaudal plane, and then it's turned and it's squeezed from side to side, called a mediolateral plane.
Dr. Vijay Narang Singh, Trinidad's top general and vascular surgeon, who is also well respected around the world. Professor Jai Narang was doing a demonstration to see news in Trinidad. The mammogram, though, is notoriously inaccurate when used for women under the age of 50, according to Professor Narang Singh. However, females with breast cancer lumps undergo a number of other tests to ensure the correct diagnosis and treatment.
You have ultrasound, you have clinical examination, you have biopsies of various sorts, whether it's fine needle cytology or core biopsy and so on.
There are two types of mammography, screening and diagnostic. The former is used in general screening, and the latter is used when a woman has a complaint about her breast, either a pain or a lump. Usually, a diagnostic mammogram follows with a diagnostic ultrasound for solid and static lumps. The eminent professor ideally tells women to seek advice before the lumps get larger.
We need to see somebody who has a painless lump, early painless lump, less than 2 centimeters in size or about 2 centimeters. This is a breast that has been removed, and these are the glands. You can see these glands under the arm here, these glands. So the cancer has spread. You can see a little skin tethering here. This one was tethered to the skin. The cancer has moved from this site up to the glands under the arm.
The reasons the underarm lumps nodes is removed is twofold. There is a chance they can still be infected, or if left uninfected, the cancer can regrow and spread.
Because it spreads by the bloodstream. So it can spread by the lymph glands, which is how you get the lymph glands under the arm, but that is not as disastrous as when it spreads in the blood. Because when it spreads in the blood, it goes to your lungs, goes to your bones and liver, and these are the things that kill.
The professor is amongst the world's top vascular surgeons and consultants and believes more needs to be done in Trinidad and Tobago to reverse these statistical imbalances that see 5 women dying every week of breast cancer. Andrew Wicks reporting for HGP Nightly News.